Respirators in the workplace have one main goal: to keep employees safe. In order for a respirator to do its job, it has to fit each person properly. OSHA requires the employer to develop a written respiratory protection program, use properly selected respirators for this purpose, provide medical evaluations of employees prior to respirator use, and provide respirator training and fit testing prior to initial use of the respirator and at least annually thereafter. Today, we will show you how the fit test is done using respirators from Kimberly-Clark Professional. We will show you donning, seal check, threshold screen, fit test. First, the wearer must inspect the respirator. There should be no tears or rips, and there should be an adjustable nose clip. Next, to don the respirator, hold the respirator with the head straps hanging forward over the front of the nose clip. Place the respirator over the nose and mouth. Place the bottom elastic strap over the head just below your ears. Place the top head strap over the head above the ears. Untwist the strap. Using both hands, carefully shape the nose clip to fit the nose and adjust the respirator to achieve a completely tight fit to the face. Test the tightness of the facial fit by covering the front of the respirator with both hands and inhale sharply. Readjust the nose clip if there are air leaks. Once the respirator has been donned, perform a seal check, which must be done each time the respirator is worn to ensure an adequate seal is achieved. This is done by forcefully exhaling several times. The respirator should bulge out slightly. The wearer shouldn't feel any air leakage. If the wearer has trouble with the seal check, they should try these three things. First, use a mirror while adjusting the respirator. Second, ask someone to look for anything caught in the seal. Or third, make sure the headbands are positioned properly. Once the fit test administrator and the respirator wearer have done a seal check after proper donning, according to OSHA standards for respirator protection, it's time for the qualitative fit test, which tests an individual's ability to detect a sweet or bitter taste through a respirator. Or quantitative fit test, which numerically measures the amount of leakage into a respirator. Both are accepted by OSHA, but we'll be demonstrating only the qualitative fit testing method. The fit test procedure is divided into two parts: the taste threshold screening and the fit test. The taste threshold is performed while the test subject is not wearing a respirator. This test will be done with a weak solution of the agent. The fit test uses full-strength solution, and you can use either the saccharin-based or the Bitrex. Both are accepted by OSHA. To prepare for the fit test, first, unscrew the bottom half of the threshold screening nebulizer and pour in a small amount of the threshold solution, about a teaspoon, then replace the top. Prepare the fit test nebulizer with the fit test solution in the same manner. Instruct the subject to place the hood with the bouffant cap covering the top over their head. Remember, the subject should not be wearing a respirator. Tell the subject to report to you immediately when they taste the agent. Insert the nebulizer into the hole at the front of the hood. Firmly squeeze the bulb 10 times. If the subject reports a sweet taste, write down 10 as the number of squeezes. If they have not reported a taste, squeeze another 10 or 20 times. Write down the appropriate number of squeezes required. If the taste threshold is successful, instruct the subject to remove the hood and rinse their mouth with water and wipe their face. Before beginning the fit test, the subject should don and seal check the respirator. After the donning and seal check are successful, the person should wear the respirator for at least 5 minutes to check the comfort of the respirator. Is the subject's chin properly placed? Is there room for eye protection? Now it's time for the qualitative fit test. Place the hood on the subject, making sure there is sufficient room for the subject to move their head from side to side and up and down. Instruct the subject to breathe with a slightly open mouth. Insert the nozzle of the fit test nebulizer into the hole at the front of the hood and spray 10, 20, or 30 squeezes into the hood, depending on which number was recorded from the threshold screening. Maintain the aerosol concentration in the hood throughout the test by squeezing 1/2 the initial number of squeezes every 30 seconds into the hood. Instruct the subject to do these series of exercises for 60 seconds. Normal breathing. Deep breathing. Turning head side to side and then inhale. Moving head up and down and then inhale. Talking. Read the rainbow passage included in your kit. Jogging in place. Normal breathing. If the exercises are completed without the subject tasting the solution, then an acceptable fit is demonstrated and the subject has passed the test. If the subject reported tasting the solution, the subject should be allowed to retest with a different or same respirator of their choice. Wait 15 minutes between tests. Repeat all tests described in this video. Donning, seal check, threshold screen, fit test. You are now prepared to train others on how to administer the qualitative fit test protocol required by OSHA.